Hi, today I wanted to talk to you about birth control. I have a lot of women coming into the office to see me for just that reason. I also have 6 other providers in the office seeing patients every day for similar reasons. And so, given the amount of misinformation on the internet and that we all tend to get by word of mouth from our friends, most of it bad, unfortunately, I thought it would be good to clear up a few things. So, there are multiple types of birth control. Abstinence, for instance, is one. Condoms are probably the oldest type. Condoms are still used with or without spermicide. Then there's birth control pills. Now, birth control pills have been out since the early 60s. And initially, they were fairly high dose, such as 75 milligrams. We don't see those pills anymore. They kept decreasing the dosage over the years, and now we're down to 30 milligrams of estrogen being the highest dose pills available. Birth control pills have 2 hormones in them, estrogen and progesterone. Most of them do. There are a few on the market that have progesterone only. Those are pretty much reserved for women who are nursing so that the estrogen doesn't dry up the milk supply. So for most people who are interested in a birth control pill, they're going to get a lower dose pill that has either 30 milligrams of estrogen plus a progesterone, 20 milligrams plus a progesterone, or even 10 milligrams of estrogen. There's only one pill on the market that has only 10 milligrams, and it's one of my favorite pills, fewest side effects. There are a lot of things that you have to take into consideration when you're prescribing birth control pills. I always try to remember to ask the patient if she has a family history or a personal history of blood clots in the leg or lungs. Birth control pills can increase your risk for blood clots in the leg or lungs. It's very uncommon nowadays given our lower dose pills. The big thing about birth control pills is you have to remember to take it every day. With smartphones, which everybody seems to have nowadays, it's pretty easy. You set an alarm on your phone, but you have to stop what you're doing and take the pill, or that's not going to work either. Another method is something called Nexplanon. It's a very small silastic capsule that goes under the skin of your upper arm. It contains progesterone only, and it lasts for 3 years. It's very easy. The biggest drawback that I've seen is irregular, unpredictable bleeding. In other words, you probably won't have regular menstrual periods. There are a few other side effects that I've seen in various other people, but mostly it's the irregular bleeding. I try to discourage people from it, but there are people who have had one and then another in succession who do very well on it. There's something called Depo-Provera, which is an injection. Drawbacks with that, you have to come in and get a shot every 3 months. Well, you may know someone who's a nurse who could give you the shot every 3 months. The pharmacy could give you the shot. So that's not such a big deal. However, what we do see is a lot of people gain weight on it. It can make depression worse, and nobody wants either one of those things. It is excellent for a specific group of people. I'll just leave it at that. Then there's an intrauterine device. That definitely is my current favorite type of birth control. Why is it my favorite? Because I see the fewest problems with it. The one that I prefer to insert is Liletta, and it contains a small amount of progesterone. It's actually such a small amount that it's only absorbed into the uterus itself, and it affects the lining of the uterus in such a way that it stops growing. it's okay to do that if you have progesterone. And so if the lining of your uterus isn't growing, there's nothing to shed every month. So you end up not having a menstrual period at all. The Liletta is good for 6 years. The biggest drawback is insertion. In a lot of people, it causes cramping. Yes, cramping's uncomfortable, but there are things that you can do to minimize that, things you can take beforehand, such as naproxen. I also like to give people a pill to soften up their cervix the day before the insertion. That helps a lot. If you've just had a baby, it's really easy to have it inserted. So again, that's a wonderful form of birth control. It's good for 6 years. Your periods stop. You really should be examined every year and have an annual exam. It doesn't mean you don't have to come in and be examined, but you will stop having periods. And then, of course, there's permanent sterilization. That's for people who are 100% positive they are done having children, or have never had children and don't want any, and don't want to run the risk of accidental conception. So that's a procedure done in the operating room. And in this day and age, most OBGYNs are completely removing the fallopian tube. The fallopian tube is the thing that carries the fertilized egg from the ovary into the uterus. If you remove the fallopian tube, then the egg has nowhere to go, sperm can't get through to get to the egg, so that risk is gone. Why do we take the whole tube now, you might wonder? Well, over the recent history, we've learned that most ovarian cancers actually begin in the end of the fallopian tube. If this is your fallopian tube and this is your uterus and this is your ovary, this area here is called the fimbriated end, and that's where most what's called ovarian cancers originate. This has been discovered on pathology when the tubes are taken out, like with a hysterectomy. They have found very, very early cancers of the kind that usually come from the ovary, or we thought came from the ovary. So that's why we take the entire fallopian tube. So once you have the procedure done, there's no turning back. There's no reconnecting of the ends or untying the tubes. It's a permanent procedure, so be sure that you are done. Now, of course, there's always in vitro fertilization, adoption. There are other ways to have children. So let's talk for a minute about effectiveness. Obviously, the most effective method is abstinence. Condoms are great if you've used them for a long time and you're really good at it. There is a learning curve with condoms, and I won't get into the specifics, but if they're used correctly, they're probably about 80 to 90% effective. Birth control pills, if taken correctly, which means daily at the same time of day, are about 92 to 95% effective. If these numbers don't mean anything to you, it's okay. What you need to know is nothing is 100% effective except abstinence, and in this day and age, tubal removal. Nexplanon in the arm is very close to 100% effective, probably 98 to 99. And the people that come up pregnant with that are probably the ones that were pregnant before it was inserted and their pregnancy test was still negative, for instance. The IUD is highly effective, 98, 99%, as long as it's in the uterus where it's supposed to be. It can accidentally get pulled out if the woman is wearing tampons when she has a little bit of spotting, but that doesn't usually happen. Depo-Provera is fairly effective as long as you're getting your shots on time. And sterilization, as I said, with complete tubal removal, it's very, very effective. Now, back before we were doing complete tubal removal and just taking a little segment out, like this is the tube again, we would just cut it here, tie it, cut it here, tie it, and remove that. Well, 4% of those failed and people would become pregnant. And when you look in there again at the tube, you see there are two ends. They're not connected, but somehow the sperm managed to get through, the egg, fertilized egg, managed to get back. Although half of those do get stuck in the tube, and that's a surgical emergency. It's called an ectopic pregnancy. But now that the whole tube is gone, I haven't seen a pregnancy. That doesn't mean it won't happen someday. Safety is another question you might have. Obviously, abstinence, very safe. Condoms, very safe. The upside of condoms is they protect you from some sexually transmitted illnesses, like gonorrhea or chlamydia. They're not going to protect you from the ones that are bloodborne or passed in other bodily fluids, like from kissing. They're not going to protect you from human papillomavirus, or HPV, which is warts. It's the virus that causes cancer of the cervix, and it's not going to protect you from herpes. About the only thing that condoms are really good at is protecting you from gonorrhea and chlamydia, but you have to use them every time you have sex. Birth control pills, I already kind of mentioned the risk of blood clots in your leg or lungs, but it is really, really rare now, given the low dose pills that we have to prescribe. The Nexplanon, incredibly safe now. When it was first introduced, sometimes the capsules got implanted deeply. Now they have an insertion device that prevents it from being inserted deep. It goes right under the skin, and the insertion device protects the arm so that that's where it ends up. Depo-Provera, as with any other injection, you can have a reaction to it. You can have get an abscess where you get the shot, also very rare. The IUD, there is a possibility that it'll come out and you don't know it. I don't even have people try to check strings because I think it's probably difficult to impossible for most people. In very rare instances, we have found IUDs outside of the uterus, inside the abdominal cavity. My personal feeling is that it happened at the time of insertion, and the uterus was somehow perforated and the IUD was put into the abdominal cavity to begin with. It's important when you're inserting it to pay attention to what your patient is telling you. If it's excruciatingly painful, there's probably something wrong. You should stop what you're doing. Take a step back and regroup. When I have difficulty finding the direction of the uterus, whether it goes that way or that way, I just stop and go take them into the ultrasound room and do it with ultrasound guidance. It's very safe that way. I can see exactly where I'm going. Overall, that's my take on birth control. Please come into the office and see one of our providers, and we will gladly help you with your method of choice.